Welcome back to Think Like a Nurse 2. This topic today that we're going to cover is regarding female reproductive disorders, and our focus is going to be related to vaginal bleeding or amenorrhea, which is absence of bleeding. So we're going to talk about the menstrual cycle. In our first segment, we really focused on the hormone targets of the menstrual cycle and how that 28-day cycle is very important in determining a female's physical and also hormonal health. But amenorrhea is absence of bleeding. And then we're going to move on to some other key terms. That's going to be menarche or menarche, whichever way you choose to pronounce that. That is the female's first menstrual cycle. Usually it's anticipated somewhere between the age of 8 and the age of 15. If a female has not obtained a menstrual cycle around the age of 15 or 16 years of age, then that client would need to have a good, thorough physical and or hormonal examination to determine whether or not there may be a problem in with that client's hormonal cycle. Some females may actually be born without a uterus. They possibly also may be born without an ovary or be born without both ovaries, and or they may have dysfunctions of the pituitary gland causing them to have problems with their cycles. So we're not going to go too in depth and detail into the different kinds of prolactin disorders and things like that. We're going to kind of try to focus more in this segment on the actual cycle itself and some of the key terms as we introduced earlier. So menarche again was the first menstrual cycle. Usually with females, like I said, there is no actual set time. It usually tends to trend around whenever their mother or their female parent started experiencing a menstrual cycle. So if that information is available, then that may be help us determine when that client may start a cycle. And like I said, if she has not started a cycle by around the age of 15 to 16, then we need to find out why the female has actually not reached puberty. So at this particular point in time, actually having the menstrual cycle indicates that the lining of the uterus is shedding off. Could it be potential for a younger client to become pregnant prior to the presence of the menarche? Yes, certainly they could, because if they are ovulatory, which generally for females, they will start to ovulate usually a couple of months before they actually have a menstrual cycle. So it is potential that they could become pregnant even if they had not started a menstrual cycle yet, pending that their bodies are developing or producing eggs at that, within that hot zone area that we talked about earlier around day 14 would be when the female actually ovulates. Usually with menarche, the presence of the first menstrual cycle, a female at first, maybe within the first 6 months, usually does not follow a characteristic monthly pattern. And that is not abnormal, and we want to reassure our clients and our parents of our younger clients that those menstrual cycles will take time for them to continue to get in sync, and that the best way that we can handle and manage that is just tell the females to keep up with that menstrual calendar and be prepared and have supplies in case they fall outside of those characteristic windows, if their cycle comes around every 21 days and or if their cycle comes around later. So usually after about 6 months after the first menarche, then the client may not have a cycle for another month or two thereafter. Then it may not come back again for another 2 to 3 months. But then after that 6 month time, we would expect that those cycles start becoming more regular, that their flows are much more, the menstrual flow is much more determinate. You can determine when the light day of the cycle will be, and then followed by the heavy days. And it usually gives the client an indication of about how long those menstrual cycles can last. For a female, there is no, again, magic number there. They can have a cycle 2 days, 3 days, 7 days, 10 days. So we just kind of gauge and watch how much they're bleeding. Of course, anytime we have a client that is having a hemorrhage or some excessive bleeding, then we're very concerned about their blood volume and their red blood counts and those kinds of things. So pending the client was experiencing problems, we would start doing a little more in-depth research into their blood and checking those labs to determine whether or not that may be problematic. However, we're talking about menorrhagia. That just means that the client is actually having a heavy cycle. When they menstruate or have menses, this is just the normal or expected menstrual cycle itself. Usually what we tell the client to do is to gauge their bleeding by soaking of one maxi pad within 1 hour's time or one super tampon in 1 hour's time. So if they're soaking more than that within a 1 hour time period or time frame, then that would be considered to be excessive bleeding. So how we usually manage that is ask the female client to get off her feet, put her feet up and rest, especially if she's been engaged in a lot of sports activities or heavy physical type activities. We'll have her rest off her feet, and hopefully this and continued oral hydration will help that cycle to start tapering and the flow starting to lessen. We'll continue to tell that client and or family member to help monitor or gauge those cycles. And if the cycles don't slow down, then that could be an indication that there is a problem with the progesterone level and or signaling the progesterone level to start rising again, to help stop that menstrual cycle. Or the client, there may be an indication for the client to need some type of oral contraceptive pill and or hormonal type injection to help maintain those cycles. So when you're looking at your birth control pill or oral contraceptive pill, in all cases a female is not necessarily on those for contraception, but therefore may be on those to help regulate that menstrual flow and or menstrual cycle. A lot of clients, pending their actual careers or travel and different things, depending on what type of sports they play. If they engage in sports, they may choose to have their gynecologist or female health or healthcare provider actually provide some type of birth control pills or hormonal pills to help regulate a cycle and or help to diminish the presence of the cycle. But we'll talk more in detail about that when we get to our contraceptive section. So menorrhagia actually is just heavy bleeding. The menses is the cycle itself or menstruation, and menorrhagia is an actual heavy menstrual cycle. If the client is having bleeding between cycles, that is called metro, M-E-T-R-O, metrorrhagia. Metrorrhagia, and that means that the client is having bleeding somewhere between that 21 day and that 35. They're having presence of bleeding earlier than anticipated with the menstrual cycle, so that's called metrorrhagia. If that bleeding in the middle of that cycle is very heavy, it is called menometrorrhagia. So those are just some terms that you need to be familiar with, because when you're reviewing charts and or talking with the client, of course we're going to use layman's terms, but when we're referencing charts and documenting information, utilizing ICD-9 codes or ICD-10 codes, etc., and those billing type codes, then we need to be familiar with this type of terminology to be able to document what kind of complaints the client is actually having appropriately. So again, these are just some key terms to get familiar with, and at our next session, we're going to talk more in detail about different types of female reproductive disorders, but I wanted you to be familiar with the terminology, so therefore we'll be able to move forward more smoothly with our next encounter. Thank you so much for joining me, and I hope to see you again. Thanks. Bye-bye.